Hello everyone and welcome to my presentation. My name is Julia and today I'll be presenting bulimia nervosa, which is a common eating disorder. Throughout this presentation, I'm going to go over the disorder and how it's presented in the DSM-5-TR, and then several other eating disorders that are similar to this one, and different kinds of treatment options and the role that social workers play when it comes to supporting those who struggle with this eating disorder and how to reduce the stigma that surrounds it. Let's begin with what bulimia nervosa actually is. It is a serious eating disorder that is recognized in the DSM-5. People with bulimia have various episodes where they eat a large amount of food, binge eating, in a short amount of time, and they feel like they can't control their eating, so they try to do something to prevent the weight gain that comes with the binge eating, such as making themselves throw up. They can fast, they exercise too much, or sometimes they use laxatives in the wrong way. Another important part of this disorder is the person's self-worth and how it's strongly connected to their body weight and shape. It's important to know that bulimia can affect anybody, regardless of their gender, their age, their body type. Many people with bulimia are sometimes at normal weights, but it's difficult for them to recognize that, so they try to take some control back. This eating disorder wasn't always recognized as a mental health disorder. In this slide, we're going to go over the history of bulimia nervosa. In 1979, there was a psychiatrist named Gerald Russell who's the first to describe this as a separate condition. A year later, it was added in the DSM-3. Over the years, the diagnostic criteria has changed a lot, and researchers learned a lot more about this disorder. In the DSM-4, binge eating and other different types of behaviors had to occur at least twice a week. In the DSM-5, it was changed to once a week for 3 months, and it made it a lot easier to identify the people who still needed treatment and had this disorder. The DSM-5-TR continues with this same criteria. To properly diagnose this disorder, a person must meet several criteria that is outlined in the DSM-5-TR. First, they experience repeated episodes of binge eating, meaning they eat an unusually large amount of food in a short period of time and they can't control their eating. After these episodes, they try to prevent the weight gain by doing things like making themselves vomit, fasting, exercising too much, or even using laxatives. And these behaviors happen at least once a week for 3 months. Another important part of the diagnosis is that a person's self-esteem is strongly influenced by the body weight or shape. And finally, if someone meets the criteria for anorexia nervosa, they would be diagnosed with anorexia instead of bulimia nervosa. All of this criteria helps clinicians make a more accurate diagnosis so that they can get the proper treatment. In this next slide, we learn about the different signs and symptoms that a person can feel both mentally and physically when it comes to bulimia nervosa. Behaviorally, someone can have repeated episodes of binge eating, eat in secret, go in the bathroom right after meals, or try to prevent weight gain by exercising a lot more using laxatives. Over the time, the behaviors can lead to physical problems, such as dental erosion from the stomach acid of the throw up, or sore throat and swollen salivary glands, feeling dehydrated, and even electrolyte imbalances. Some people also develop calluses on their knuckles from the repeated induced vomiting, and it's known as Russell's sign. Emotionally, a lot of people experience feelings of guilt and shame after the binge eating, and they also struggle with anxiety and depression and a strong fear of gaining weight, which can have a significant impact on their self-esteem. Bulimia nervosa can look similar to a lot of other eating disorders, so it's important to notice the differences. People with anorexia nervosa may also binge and purge, but they are significantly underweight because they restrict their eating a lot more. Binge eating disorder involves a lot of binge eating, just like bulimia, but people don't regularly use behaviors like vomiting or excessive exercise to prevent the weight gain. With avoidant restrictive food intake disorder, otherwise known as ARFID, is different because people avoid or restrict food for reasons other than body image, like sensory issues or a lack of interest in eating. It's important to notice all these differences in each eating disorder so that clinicians can make a more correct diagnosis. I added in this short video because it goes over some of the causes of bulimia nervosa. One thing that is important to take away from this video is that there isn't just one single cause to developing an eating disorder. It's caused by a number of things, such as one's environment and their social factors. Now let's go over what we've learned and applied our knowledge to these case studies I've added. For this first one, it is a girl named Sarah who is 22 years old and she is a college student. Some of her symptoms include binge eating several times a week and feeling guilty afterwards. She's also gained some weight over the past year, and these behaviors have continued for the last 6 months. Based on all this information, do you think that Sarah meets the criteria for bulimia nervosa? The answer is actually no. While Sarah does experience the binge eating, she isn't using behaviors like vomiting or fasting, excessive exercise to help prevent the weight gain. Because of that, this is more consistent with binge eating disorder rather than bulimia nervosa. Now let's take a look at the second case. It is a girl named Megan who is 20 years old and is also a college student. Now, Megan here binge eats 2 to 3 times each week, and she feels like she can't control these eating episodes. After the episode, she usually makes herself vomit because she's worried about gaining weight. She's also concerned about her body shape and weight, and these behaviors have continued on for 4 months. Now, based on what you learned here, do you think Megan meets the criteria for bulimia nervosa? The answer is yes. Megan does meet the criteria for the DSM-5-TR bulimia nervosa. The reason is because she has repeated the binge eating. She uses behaviors such as preventing the weight gain, like self-induced vomiting. And in this case, these behaviors have been happening for more than 3 months. This case is actually a really good example of how clinicians use the DSM-5-TR criteria to make this an accurate diagnosis. Looking back at the video we watched a couple slides ago, there isn't one single cause when it comes to bulimia nervosa. Instead, it's a result of several different factors that are working together. Some people have what's called biological risk, which is such as like family history or genetic predisposition. There are psychological factors such as low self-esteem, perfectionism, anxiety, or depression, which can increase someone's risk. There are social factors such as pressure to look a certain way, dieting culture, social media, and finally, there are environmental experiences like trauma, family conflict, or weight-related bullying that can contribute to the development of gaining this disorder. While these factors increase a person's risk, it doesn't necessarily mean they will. As soon as clinicians suspect bulimia nervosa, they go through the first step of assessment. This usually includes a clinical interview using the DSM-5-TR criteria, a medical evaluation to check for complications like dehydration, electrolyte imbalances, and screening for other mental health conditions such as anxiety or depression. It's also important to assess for suicide risk and self-harm. After a diagnosis is made, treatment involves a combination of approaches. The first line of treatment is enhanced cognitive behavioral therapy, or CBT-E, which helps individuals change unhealthy thoughts and behaviors related to food and body image. There's also interpersonal therapy, or IPT, which is another effective option. Treatment also includes nutritional counseling and often involves a team of healthcare professionals working together to support the person's recovery. While therapy is the main treatment for bulimia nervosa, medication can also be helpful. The only FDA-approved medication for this eating disorder is fluoxetine, also known as Prozac, which is a type of antidepressant called SSRI. Fluoxetine can help reduce the binge eating and purging behaviors, especially when it's combined with therapy. It can also help people who have anxiety and depression. While the medication can make a difference, it's better when they are worked together with. The role social workers play when it comes to helping these individuals with these types of eating disorders is extremely important to their recovery. One of the most important things we can do is create a safe, supportive, and non-judgmental environment where people feel comfortable asking for help. Social workers can assess for eating disorders and other mental health conditions, and they can coordinate with other professionals and connect people with resources and help. We also have the responsibility to challenge the stigma around eating disorders. Bulimia can affect people of all gender, age, and race and body sizes, so it's important not to make any kind of assumptions based on appearance. By providing compassionate, person-centered care, social workers can help individuals feel supported and improve their chances of recovery. We've reached the end of the presentation, and so we're going to go over some of the key takeaway points of bulimia nervosa. It is a serious, but it's treatable eating disorder. It involves reoccurring binge eating followed by behaviors to prevent weight gain. Early recognition and diagnosis are crucial because the disorder can have serious physical and emotional effects if left untreated. There have been cases where individuals are left dead because of how serious these causes have. Recovery is possible with the right support. A combination of therapy, medication when appropriate, and a strong support system can make a significant difference to those. As future social workers, we have an important role when it comes to recognizing these types of signs and reducing the stigma that comes with eating disorders, and focusing on clients that do need the care and need the help and the support. I appreciate everybody for listening to my presentation. Thank you so much, and I hope you all have a good rest of your summer.